So hello everyone, today we will be discussing a very interesting topic, that is the major vessels of the body. Alright, so the major vessels comprise of the arteries and veins. I hope by now you have this much understanding. So we will be diving into this kind of pictures, and I really hope if you have purchased your set of textbooks, you will be getting some charts. Like in Indian authors, most of the textbooks, they give some charts which you can paste on your hostel walls and everything. So they will be including some arteries and veins. So a chart just like this and a chart just like this. So this shows the various arteries and this one shows the various veins. Okay, but let me make this class very interesting and I will incorporate everything in 3D. Okay, let me just show you all these structures in 3D alone. Okay, the veins as well as the arteries. Okay, so let us dive in first for the arteries. All right, so you are familiar with this skeleton now, right? So let me bring up the arterial system. Okay, so you can see this beating heart in the center, which will act as a starting point for us. Okay, so let me remove this sternum. You can see this heart with the fibrous pericardium. We will study all these things region wise about the pericardium and everything. Now you can see, if I even just remove the minor arteries, all right, so you can see this beautiful beating heart in this animation, right? So now our job is to understand the major pipes, the major vessels in the body. Okay, so first we will talk about the arteries. So if you remember from your class, that is the heart. If I just need to cut open I'm just cutting it open. Let me remove the skeleton for time being. All right, so I'm just opening the heart so that you get a better understanding. Okay, so now see this beating heart. From your background knowledge, I guess you can remember that there are 4 chambers of the heart, right? The one which you are looking at, this opened one, is the right. This is the right atrium. Okay, and into this right atrium you can see 2 vessels going in, that is the superior vena cava, we will talk about in a while, and then you have the inferior vena cava, which you can see below. Okay, then the blood, that is a deoxygenated blood in the adults I'm talking about, deoxygenated blood is entering into this right atrium. Okay, and it goes and passes into the right ventricle via this tricuspid valve. If you can see 1, 2 and 3, so there are 3 cusps of this valve. Okay, we will talk about that when we will discuss the heart in detail. And then the blood rushes inside into the right right ventricle. All right, and here you can see a lot of things. Just let me remove one layer more. Okay, here you can see these cusps which were shown from the other side, and you can see the wire-like structures which are connecting, just hold on, the wire-like structures which are connecting the cusps to the muscles. Okay, so these are known as the chordae tendineae. We will talk about in the heart chapter in the thorax. These are the papillary muscles. Okay, you can see the 3 sets of papillary muscles on this side. Okay, so 1, 2 and 3. 3 cusps on the right side, 3 papillary muscles connected by the chordae tendineae. So now the blood has entered into the right ventricle. Now the blood will move out into the pulmonary trunk. So this one is the pulmonary trunk. So here the blood enters and goes into this pulmonary trunk. Okay, now you all know pulmonary trunk will further bifurcate into 2. Okay, the right and the left pulmonary artery. All right, and you can see this very beautifully shown here, the right and the left side. So this pulmonary artery, if you see, this will be going inside the lungs. Now the blood will get oxygenated, and then what will happen? The blood has to enter back into the heart. Now I have moved from the back side. Okay, so now the blood will enter into the heart via the which atrium? That is a left atrium. Okay, and via the pulmonary veins. So there will be pulmonary veins which are 4 in number, 2 superior and 2 inferior. Alright, so they will be entering into this. If I just try to hide, okay, you can see this region. This is the left atrium. Okay, so this left atrium if I just fade it up, so maybe you can see inside this left atrium. If we go, I just have to remove this. Okay, if we just go inside the left atrium, the blood has entered now. Then we can see 2 cusps, that is a bicuspid valve on the left side. Okay, 1 cusp and 2 cusp. Then the blood will enter into the left ventricle. Okay, left ventricle. Similarly, there are 2 cusps. Okay, I told you 2 cusps on the right side, on the left side, and you can see the chordae tendineae and connecting to the papillary muscles. Again, 2 papillary muscles, 2 set of papillary muscles on the left side. Okay, so the blood has entered into the left ventricle now. Now the blood will go and pump into the entire body through the aorta. Okay, so let me show you. Here we have the blood entering, and now the blood will go into this passage, which you can see. Okay, so now the blood will enter into this structure, that is the aorta. Okay, so this is the ascending aorta. I hope by now you have understood what is ascending aorta, from where we have reached the blood into this. Now the things become very easy. Let me bring the skeleton back. Okay, now we know from where the blood we have to start. So now the point of discussion will begin for the major arteries, major pipes in the body through the aorta. Now have a look. In this class is very important. It will save your image. You will not be having distress in the Viva exams if you know this basic fundays. Okay, because you study hi-fi, you forget the basics. Now you see this is the arch of aorta. Okay, the arch, which will be discussed multiple times to you in various classes. So arch of aorta, you can see giving off 3 main branches. All right, so the first one which you can see here, that is the brachiocephalic trunk on the right side. Okay, and then in the middle you have this left common carotid artery. Okay, and then on the left side you have this subclavian artery, which is again left subclavian artery. So the subclavian and common carotid, these are directly coming from the arch of aorta on the left side, whereas on the right we have only brachiocephalic trunk. Now further brachiocephalic trunk will give off these 2 same things, that is the common carotid artery on the right side, and and this will continue into the right subclavian artery. Okay, so that means if you see properly, so 2 things are main which are coming off from the arch of aorta, that is the subclavian one, second is the common carotid. These are the 2 main vessels. Now understand very basic thing. This common carotid will be the main supply to the head and neck region. Okay, you can see this. Just let me see. This common carotid will be supplying the head and neck region on both sides, right? This is the main going up. Then if you see about the subclavian, this was the subclavian, right, on either side. Subclavian artery is going towards what structure? If you see the main pipeline, starting point of the arterial supply to the upper limb. Okay, so this is a very important catch point. And another vessel which you can see very clearly here, that is the vertebral artery. Now vertebral artery and the common carotid, they both are the major supply, the only major supply to the head and neck region. Okay, in this vertebral artery is running inside the foramen transversariums, okay, of the cervical vertebrae, that we will discuss eventually in detail, okay, in head and neck region. So you can see this is entering inside the cranium. Okay, you can see it's going inside the cranium. Can you appreciate this? Is going and on either side this vertebral artery unites to form this basilar artery. If I just enter inside the cranium, okay, so you can see this is the basilar artery, which we will study in detail further later on, okay, in neuroanatomy and everything. So I think by now you got an orientation that 2 major vessels out of this common carotid will further bifurcate into 2 main vessels that is the external carotid artery and the internal carotid artery. Internal, as the name suggests, it will go inside the cranium, okay, and external will stay outside and supply the face and neck and all these muscles and structures, okay. So I hope you understood the main pipeline which is going upwards in the head and neck. Now let us trace the main pipeline in the upper limb. So I will take this on this side. Okay, one more thing just to add on here, although we'll discuss later definitely. This vertebral artery is always the branch coming from the first part of subclavian artery, okay, and this subclavian artery is also further divided into various parts based on a muscle. We will discuss the various arteries like axillary artery, subclavian artery, okay, the maxillary artery, which has certain parts, and there are some muscle which is intervening in between them, and that leads to the various parts. We will discuss the branches and everything, okay. So talking about this subclavian, I hope you know where we have come to the subclavian right now. Now you see and trace this subclavian, and if you see carefully, the subclavian changes its name to axillary artery, and axillary artery is known to be called as axillary artery from the outer border of the first rib. So that is also a landmark structure which we will talk to you eventually, okay. So this is the axillary artery which we have reached. Axilla, okay, armpit region. So axillary artery, I hope it is easy to remember. Then move on further. There are minor branches which we will discuss eventually region wise, but I am talking about the major vessels of the body, okay. So this axillary artery continues as brachial artery. Brachium, arm is known as brachium, okay. So brachial artery, this brachial artery is further splitting up into two. You can see that is taking the same name, that is the radial and the ulnar artery, okay. So we have two bones, radius and ulna, you know this. So the two names will be given, radial and ulnar artery. And then further these arteries will go in the hand region, and they will form some arches, the palmar arches, which we will discuss eventually topic wise, okay. So I hope you got this point, what major vessels are supplying both the upper limbs and the head and neck region inside the cranium as well. Next we come on to this thorax. So thorax is very easy. If you see, this was the ascending aorta which was just arising, then there was an arch which was formed. This is the arch of aorta, aortic arch. Then if we turn it in this manner, you can see it is in the posterior aspect. We can see this is the thoracic aorta. So thoracic aorta, if you can very well appreciate, only this part is the thoracic aorta, okay. If I just show you in this manner, why only this part? Because below this level there will be the abdominal diaphragm, thoraco-abdominal diaphragm. So from the diaphragm onward, diaphragm is a partition between the thorax and abdomen, if you know, right. So from the point of diaphragm there is an opening, that is aortic opening. From that point onwards it will be known as the abdominal aorta. So thorax will have all the arteries which are coming in, supplying in from this region, that is the thoracic aorta. Then coming on to the abdomen region, abdomen region is supplied by this abdominal aorta. There are a lot of branches of abdominal aorta which we will discuss. I can add them, which I have just hidden. Now you can see it's a whole network of arteries which you can appreciate, right. So this all the visceras are removed, so all these arteries, and trust me, welcome to MBBS, all these arteries it will be on your tips eventually when we will move on region wise. I will rotate, pan, zoom, everything. I will show you so many things in 3D so that you remember by heart, okay. At least 90% of the arteries will be known to you from this entire network which you can see here, okay. Now you see this thoracic aorta continued into the abdominal aorta. Abdominal aorta, if you see carefully, there are three major branches, ventral major branches of the abdominal aorta. I have even made an Instagram augmented reality reel on this. You can just go to my Instagram handle dr.nikhil.md.kgmu, and you can see the reels, that is educational reels, not dancing reels, educational reels on the various topics of anatomy which I have presented in an augmented reality manner. It's very beautiful and new thing which is not done by anyone till now. So you can do have a look and go and check out my profile on Insta for that, and even on YouTube I have added the same. So you can just have a look on YouTube, Instagram, wherever you feel like, and connect with me. So now you see and that will ignite your memory, visual memory, to remember better. So now you see this is the first ventral branch topmost, that is a celiac trunk. Celiac trunk further is giving off some major branches which we will discuss eventually very in detail in the abdomen region. And here you can see another ventral branch, important one, that is the superior mesenteric artery, that will supply the entire mesentery, the all these coils of intestine. We will discuss that in detail. Then you can see another major ventral branch, which you can appreciate here. This one is the inferior mesenteric artery. Okay, so superior celiac trunk, superior mesenteric, inferior mesenteric, these are the major ventral branches which you have to remember. Okay, all right. So now we know this abdominal aorta. Let me just remove some layers so that you don't get scared, although you have to remember everything later on. Okay, so now you see this was the abdominal aorta supplying the abdomen. Now we come on to the pelvis and the lower limb. Okay, now in this pelvis region, if you see very carefully, there are two bifurcation of the abdominal aorta is bifurcating into two parts, that is the common iliac artery on either side. Here was common carotid, here is common iliac. Now common, where is the word common used? When there is further bifurcation. Okay, you remember internal and external carotid. So similarly, common iliac will bifurcate into further two arteries, that is the internal and external iliac. Okay, so this is the external iliac and this is the internal iliac. Just let me add the branches. Okay, so now you can see very carefully this pelvis region. See, there are many visceras in the pelvis also, right? The bladder, the uterus, there are so many regions, there are so many things in the pelvis region, which we will discuss in abdomen and pelvis separately. So if you remember this artery, this is the this one is the internal iliac artery, which further divides into anterior and posterior division. There are further branches of it, we will discuss that. But right now remember only this fact that main pipeline is the internal iliac, which is supplying the major viscera in the pelvis. Okay, then talking about this external. Now external iliac, as the name suggests, iliac, see, iliac word is taken from this ilium bone. Okay, so external iliac moving outside, external iliac, so that is the one which is going outside, and you can see it is further continuing into the major vessel for the lower limb, that is the femoral artery. Okay, so femoral artery on either side. And as a matter of fact, there is an artery which is known as deep femoral artery, which is known as profunda femoris artery. Profunda word you will hear multiple times from me. Profunda means deep. Okay, so profunda femoris. Similarly, there was profunda brachiae also in the upper limb. So here you can see the main pipeline is the femoral artery. Femoral artery further goes below femoral, because femur is in the thigh region, you remember. Now you see femoral artery goes behind and it changes the name now. Now the name becomes popliteal artery. Okay, so this is the popliteal artery. We will discuss everything in region wise, don't panic. Okay, I'm just telling the major vessels. Okay, this is the popliteal artery. Now popliteal artery further bifurcates into two. If you see here, one is the anterior tibial and one is the posterior tibial. So this bone is the tibia, if I hope you remember. So anterior tibial and posterior tibial. So there are two major vessels in the leg region. All right, and if you trace them, posterior tibial and anterior tibial, just have a look. So this anterior tibial further goes in this region in the foot region, and if you see carefully, it continues in the foot as the dorsalis pedis artery, and it is very, very, very important as a peripheral pulsation in the body. We will discuss eventually in the region wise. In patients of diabetic foot, the dorsalis pedis pulsation is to be felt and checked very carefully if you are suspecting any gangrenous lesion. Okay, because this is the very important peripheral pulsation which has to be checked. We will discuss that. So these are the major vessels which are supplying the upper limb, lower limb, and head and neck region, thorax, abdomen, and pelvis. So I hope now you have understood all these vessels. So if I take you back to this boring 2D image, okay, so same arteries which we have discussed, you can find on this same image as well. Okay, I hope that is much more better and understandable rather than just looking at this plain image, right? Next we come on to the veins. Now veins become very easy for us because we have already discussed the arteries. Okay, so many similar names you will find. So if I just bring up the veins, what do you think? I should remove the arteries, right? Otherwise you will not be able to understand. See, but in body ultimately we have so many things inside our body, right? So just see, if I just I have removed all the minor veins, we will discuss that eventually region wise, focusing on the main ones right now. Okay, now you see here, this was the main point, that is the superior vena cava, which is dead. See, now the word changes. Arteries had branches, veins will have tributaries, and there will be formative tributaries which will drain into the major vein. All right, so now you can see superior vena cava is taking the vein, the blood into the right atrium, from where the blood is coming. That is the main point. So you can see on either side, you can see one is the left side brachiocephalic and one is the right side brachiocephalic. So both side brachiocephalic is draining into the superior vena cava. Very important viva question. Okay. And here below you can see the inferior vena cava, which we discussed initially, that these two were draining into the main chambers, that is the right atrium. Now you see the names very carefully. This is the brachiocephalic vein. All right, so now the names will follow the same, that is the subclavian vein along with the subclavian artery. Okay, so we can say vessels. Okay, subclavian vessels. Similarly, many places in the body will use the word vessels. Okay. Now in this region, in the neck region, there is some difference. The word is used, that is the jugular vein. Okay, so there are two jugular veins, one on either side, internal jugular veins, and then there is an external jugular vein also. Okay, we will discuss intricate details about these two veins, extremely important in the head and neck region, because viva examinations are centered around these arteries and veins. Okay, but right now just remember the jugulars will be in the neck region. Okay. Then if I show you this further, that is subclavian vein, this is further, you can say, drained by the axillary vein. So axillary vein is taking all the venous drainage and pumping it or putting it into the subclavian vein, right? So this is reverse manner which is happening. So this is subclavian vein, that is, then we have the axillary vein in the axilla along with the axillary artery. All right, then we have two main veins in the body in the upper limb region. If you see carefully, this is the cephalic vein. Cephalic vein is on the lateral aspect. Okay, we'll discuss that also in quite detail, because this is the very important vein for catheterization also and many other places. Okay, then you have this vein, that is the basilic vein, which is relatively on the medial aspect, okay, of the arm. Now cephalic vein and basilic vein, these are the main veins which are draining into the axillary vein. This was a NEET MCQ which was asked very recently, that basilic vein drains into which of the following veins, and this has come into the miscellaneous section in INI MDS also. Okay, so this is not only for MBBS level, also for dental level. So these few things, anatomy will remain the same. Now you see this vein, communication is there. The axillary vein and the, if I just add, okay, now I have added some other veins also. Here is a very important communication. This is the median antebrachial, or I can say cubital vein. Okay, so if you have given your blood samples ever in your life, the phlebotomist which actually comes to take your sample, he punctures the vein here, if you have noticed, right? So he finds the vein in this region and he punctures, takes the sample. So this median cubital vein or median antebrachial vein is the most common vein used for the IV sampling. Okay. We will discuss that region wise. Why is it so? Because right now you don't know in too much detail. Then we have this basilic vein and cephalic vein, which we discussed, lateral and medial. All right, and then we have a lot of veins in the palm region. Okay, no need to bother, no one is going to ask you too much in detail regarding this. Okay, then let me bring back the less ones. I'm removing all the other smaller veins. Okay, so now you see, I hope you got an orientation. Jugulars in the neck, subclavian, axillary, cephalic, basilic or median cubital vein in the upper limb, Superior vena cava, inferior vena cava, we have discussed. Now you know all the veins in the thorax region will drain into the superior vena cava. Okay, then you can see the inferior vena cava, which will take all the venous drainage from the abdomen, pelvis, as well as the lower limbs. Okay, now see the names, similar pattern. The common iliac vein, similar name, that is the internal iliac vein. Then similar name, external iliac vein. External iliac vein will be carrying the drainage from which vein? That is a femoral vein. Okay, then femoral vein will be taking the drainage from which vein? In similar manner which we have discussed, artery, popliteal vein. Okay, now popliteal vein which will be taking, one more thing, you can see a very important and famous vein which we will discuss in lower limb, that is a great saphenous vein. It is a very important vein as it is most commonly used in the grafting purposes, especially in the coronary artery bypass surgery, CABG, if you know. Okay, so all these things are very important, clinically relevant. We will discuss region wise. Right now I'm just showing you the major veins in this lower limb. So we have discussed the popliteal vein, this is the great saphenous vein, and then similarly you can see there are multiple veins in the foot region also. Okay, which I am not going in detail right now. We will discuss eventually regarding the great saphenous vein and the short saphenous vein or the small saphenous vein. Okay, you can see there is this short saphenous vein which is running. If I isolate and show you, this short saphenous vein is running only in this leg region. Compare this with this one, that is the great saphenous vein. If I isolate, you can see it is running all throughout the lower limb. Okay, so this becomes very important for grafting purposes and for venesection also. Okay, we will discuss that also, what is venesection. So these are all the major vessels which you should be aware about, okay, regarding the entire human body. Okay, so if I just show you the same, one more thing before I close this, I just need to add the lymphatics also. I want to show you a very important concept here. We will use this, I think we have discussed already. The entire lymphatics, that green color lymphatics, all lymph nodes and everything from various places, ultimately that is going to certain area. So all the lymphatics will also drain into the venous system itself. So we have this on the right side, that is a right lymphatic duct. If I isolate and show you, it is just this much, so small, right? So right lymphatic duct will take away all the lymphatic drainage in the right side of the body, upper half of the body. We will discuss that. And talking about the left side, if you see, we have a structure which is known as thoracic duct. Now if you see carefully, these the main lymphatic channels, they are also draining into the venous system only, but where exactly? Into the jugulo-subclavian angle. So this is the jugular vein, this subclavian vein, so they are both draining into this brachiocephalic vein. So it is acting, it is entering into this venous system at the jugulo-subclavian angle. Okay, we will discuss that. You can see the length of this thoracic duct, it's so big as compared to that one. This has some beaded appearance also due to the walls. We will discuss that. Okay, so so this marks us very importantly understanding the venous and the arterial supply. And I show you a very beautiful thing here itself. If I just bring the arterial system again and I show you one very basic structure. If I just remove this parietal bone on either side, so you can see all these arteries, the network of arteries inside the brain, okay, inside the neuro part, and we will be discussing all these vessels also in detail. And right now I can tell you, out of this entire arteries network, you can identify the internal carotid artery. Okay, the radiologists who are doing the MRI angiograms and all, they can rotate. Nowadays you have cutting edge technologies available, right? So we can rotate, pan, zoom inside the real scans data, and we can see if there is any blockage of the artery, any structure which has been damaged. So if you see very carefully, you will read about everything in detail. But if I just have to highlight this artery, if you can see, this should be the internal carotid artery. Okay, so this siphoning part, the S-shaped part. Okay, this indicates the internal carotid artery. So in this entire network, if I show you, in this entire network of the arteries in the brain, okay, I hope it is visible, the blackish part, we can identify very easily the internal carotid, and internal carotid is the one which you can see it is coming off from the common carotid. Common carotid is bifurcating into the external and the internal carotid. All right, so through these, through this basic knowledge of anatomy, you can actually interpret the angiograms, that is a study of the vessels. Okay, you can study so many things very clearly, and you can remember eventually what are the structures. All right, so I hope you can you got some interesting insights about this area. Okay, and we will discuss everything in quite detail eventually region wise. So that's about the major vessels, that is the major arteries, major veins. In 3D we have discussed. Okay, so thank you, and I really hope you will be loving anatomy as I do. Take care. Bye bye.